In this edition of Ask the Doc, I wanted to take some time to answer one of the most commonly asked questions I get every week on what causes tennis elbow and how to get it fixed effectively. In this video, I cover the following. What is the true cause of tennis elbow that most doctors completely miss? Why do cortisone injections make the problem significantly worse? If wearing a tennis elbow brace is a good idea? And lastly, how to get it effectively treated and have long-lasting pain relief. For those of you that don't know me, my name is Dr. Maggio. I am a soft tissue injury treatment expert, specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and then reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. I get a lot of these questions every week. And just a reminder, if you have any specific topics you want me to cover for neck, shoulder, elbow, or wrist injuries, send them in. All the information to do that is available wherever you're watching this. I love covering these videos and helping you get some real answers so you can stay away from the medical merry-go-round, which is just full of pain pills, injections, and surgeries, which only make things worse. I think last week alone, I got like 5 questions just on tennis elbow. So I thought I would cover this video because a lot of people are out there dealing with it and not getting any real answers. So I want to start with just the diagnosis itself of tennis elbow. It really doesn't tell us anything. It's one of those things that I call like a junk box diagnosis. You know, people have pain in the outside part of their elbow and automatically they assume I have tennis elbow. The problem with that diagnosis is it doesn't give us a tissue specific problem about what's going on, because if we don't know what the problem is in the first place, we can never hope to fix it. So there's 2 common causes of tennis elbow, symptom presentation where you feel pain out in the outside part of the elbow that are pretty much missed by about, I'd say 95% of doctors and providers out there. The first one is what's called a radial nerve entrapment. So you have all these nerves in your upper body that start at the base of your neck and they make their way down through your shoulder, through your armpit, through your arm, all the way down to the hand. And they do a lot of like sensation and movement of the arm. One of those nerves is called the radial nerve. It's actually the biggest nerve of the upper extremity, and it can get caught in a lot of different places. So what a nerve entrapment is, it basically, nerves are built with some extra slack, like a rubber band, about 15% to keep them healthy. And they have to make their way through muscles and fascia and everything around there and bones to get where they need to go. Over time, with repetitive use, bad postures, even some injuries, the muscles get damaged. And when they get damaged, they develop this stuff that's called scar tissue. Scar tissue is like glue that gets inside the muscle. It makes it really hard for the muscle to be able to stretch and contract. And a lot of people think, hey, I never had an injury. How could I get scar tissue? It's actually way more common just from our modern postures, especially people that are on a computer a lot and typing and using their hands and a mouse. I tend to see this a lot. So basically what happens is that scar tissue gets bigger and bigger, and eventually it gets stuck to the nerve. And when it gets stuck to the nerve, it causes all sorts of problems. It causes numbness, aching, burning, tension. So a lot of times when that radial nerve is getting caught in that elbow, it presents with pain. And a lot of people think it's just a muscle problem or maybe a problem with the joint or the cartilage. But what happens is when the nerve gets caught, everything around there tightens up and it engages in this thing called protective tension. It's basically your body's way of taking the pressure off of the nerve, because if the nerve gets damaged, you don't work. So your body does whatever it can to protect the nervous system and sacrifices the muscle, the cartilage, the ligament, the fascia, everything around there to take the pressure off of that radial nerve. The other one is something called a tendinosis. Now, notice I didn't say tendinitis. A lot of people think it's tendinitis. And basically, tendinitis just tells us that there's some inflammation going on in the area. It doesn't really tell us anything. What actually happens there is something called a tendinosis. It's actually a lot worse. It's considered something called degeneration. So basically, degeneration is just a general term that things get older before their time. So a lot of times what happens is when there's a radial nerve entrapment in there, then the muscles tighten up. And then they put more pressure and they have to generate force somewhere. So it puts more pressure on the tendon itself. When that happens, the body actually starts to damage that tendon and it starts to break down. And basically, if you think of a tendinosis, it just doesn't get good blood flow. It doesn't get good oxygen, and it gets a lot of inflammation in there and a lot of pain. Now, the issue that can happen is when you have a tendinosis, when you don't use it, maybe if you've been sitting for a while, you get up, you move around, it starts to hurt. But then after you use it again, it does feel better. That's a problem because it's actually not better at all, and it's causing more problems in there as well. So a lot of times it's a tendinosis after it became a radial nerve entrapment. Cortisone shots, honestly, I say this all the time, cortisone shots are garbage, and so is the doctor that gave them to you. Cortisone shots don't do anything. They might take away some pain, but a lot of times that pain is there to tell you there is a problem. And if you just take away the pain but you don't fix anything, it actually can cause bigger problems down the road. So they've actually shown in studies repeated cortisone shots and having more and more of that actually damages the tendon even more, and then eventually it just starts to rupture. Another thing that happens is when it damages that tendon, it makes that tendinosis a lot worse, and things start to get a lot worse, and that problem is way bigger than you ever wanted to deal with. Even though you don't have the pain anymore, it's going to be a lot more painful down the road, and the only thing you can do is surgery, and surgery doesn't make it any better. It might help a little bit, but it's not going to be ever like it used to be. Does wearing a brace help it or make it worse? So when I first start treating a tennis elbow presentation, I might have the client wear a tennis elbow brace to take some of the pressure off of there, maybe if they have a job where they have to do it and things like that. But if you're throwing on a tennis elbow brace so you can do more and more activity, all you're doing is putting a band-aid on it and eventually having to deal with that problem worse and worse. Yes, the brace will take some of the force off of there, but eventually those muscles will get weaker and weaker, and they'll develop more and more scar tissue, and it will be a bigger problem down the road. So I only recommend a tennis elbow brace if you absolutely need to have it to do your job or function. But if you're doing it so you can do more of the activity that's destroying it, you might need to come to terms with the fact that you need to take it easy and let it settle down a bit and get it fixed for good. So at the end of the day, we want to get it effectively treated, and we want to get long-lasting pain relief. So my system, called the peak injury treatment method, basically we go about fixing problems for good. And it starts with a thorough and detailed history to start. We need to figure out exactly what the problem is. A lot of times people go to their doctor, their provider, like, oh, my elbow hurts. And they're like, yep, you got tennis elbow. They don't do an exam. They don't do a history. They don't do any evaluations. They just say, yep, this is what you got. Here's some pills. Here's some stretches. Here's some exercises. Don't really know what's going on. Then once we do that thorough history, we do a functional evaluation with a focused palpation. We're able to identify exactly where that dysfunction is, where that nerve might be getting caught, if there is a tendinosis, where that scar tissue is. Because if you don't know where the problem is in the first place, you sure as hell can't fix it. Then once we know where that problem is, we use a hands-on manual therapy type of treatment where we get proper depth and then tension, and then have the client go through a full range of motion to effectively break down that scar tissue or that nerve entrapment. So what I want to include first in the video this week is a demonstration of me treating a radial nerve entrapment directly on the supinator. Where it really gets caught is down deep into that supinator, and you can see when we feel in that area, it's really tight. Bad right there. So what I do is I get my depth into there and my tension, and she's pronated, and then I bring her into supination. And that nerve is just sliding under there. Now, radial nerve is a little bit different. Radial nerve will present first with some lateral elbow pain. What happens is the radial nerve comes down through here. So a lot of times people will present with some pain in the tricep back through here, and they'll have lateral elbow pain. And where it can get caught is right in here in some of these extensor muscles. A lot of times the client will actually say that they get some numbness and tingling in the web of the hand. So radial nerve will present with some numbness and tingling down through there as well. You can see there, it's very detailed, it's very focused. We're getting just the right amount of depth and the right amount of tension and breaking that down. A lot of providers that you go to end up being too compressive. They really beat that area up and cause a lot more damage than actual good in there. Then once we clean up all that scar tissue, we get rid of all those nerve entrapments, then we're going to go in and directly treat the tendon. And that we need to break down that tendinosis, because basically it's just a ball of just junk in there that needs to go away. So we use an instrument to go in there and break that tendon down. It's a little tender when we do it, but it's very effective. When we do that, it increases blood flow, increases oxygen, and that tendon starts to heal. And once that tendon starts to heal, then we start to build it up using some strengthening and some exercises. So the exercise that we do is something called eccentric type of loading. So basically what we do is we put the muscle here and then we drop it down really slow, and it allows that tendon in that elbow to start to regenerate after we've done it. Now the key is you have to clean up the scar tissue first, then the tendon, then strengthen it with the exercises. The way the medical system has it is they have it completely backwards, where they go in, and they start with stretches or exercises, or they want to get rid of the inflammation, they don't answer the question of why that inflammation is in there in the first place. It's like fixing a really bad house. We have to tear it all down and then build it back up. If you try to do exercises and stretches before you ever lay the foundation, it's all going to go to the ground. And that's why people aren't getting long lasting relief for their tennis elbow. So that's all I got for you guys in the video. If you've been dealing with tennis elbow for, I'd say, at least 6 months, you've seen lots of other providers, you've got no pain relief or improvement in any function, then you can reach out to us directly and get set up with a peak method trained provider to get some real answers and get on the path to functioning and feeling a heck of a lot better. All of the information to do that can be found directly on our website, and all of those links are available wherever you're consuming this information. I appreciate you guys watching the video, and I'll see you on the next one. Bye.